Really delighted to introduce a friend and a collaborator, Rudy Gonzales, who's the Executive Director of Servicios de la Raza, whom Sheena briefly mentioned. I've been really lucky to have the opportunity to work with Rudy and find ways that we can work together. So, Rudy, welcome.
Good morning. My name is Rudy Gonzales. I'm the Executive Director of Servicios de la Raza. And just last month, we turned 46 years old as a Chicana founded agency in Denver, founded in 1972 in Northwest Denver. And I've been leading the agency since November of 2008 as Executive Director, at which point the agency was in pretty tough straits. Pretty bad straits, and since then we've worked together. We've been fortunate in our hiring and our fund seeking, and have grown the agency from 6 employees and 2.5 service areas to now 10 service areas and 40 FTE. We are now stepping off statewide. We actually just started our active living and boot camp house services in Colorado Springs, just getting back from Grand Junction in Mesa County, also Montrose County, where we'll be working with diabetes, obesity, and active living boot camp. Active living for, in particular, the immigrant refugee communities. But I'm here to have a little bit of a courageous conversation. As a community-based organization of color, we are underfunded 7-1 in this country with our white counterparts. As a Latino, founded, led, serving, impacting community-based organization of color, we continue to struggle mightily. And so I'm here to talk a little bit about research and academia and academics, because that funding emulates the administrative inequity of funding from our philanthropic community, from our government funding communities. It emulates it in that it is starkly inequitable. When I look at this, and you look at, and you want to come and work in our communities, and work with our communities, and we're at the street level at Servicios. We serve 35,000 people a year in Denver Metro, and statewide reach in some of our programs. And we work with all of these different populations, veterans, grandparents who are raising their grandchildren, foster care, ex-offenders, gang members, people homeless, single parents, victims, people with SMI, severe mental illnesses, people mainly with PTSD, our communities with anger and frustration and depression, nihilism that comes from growing up in these communities, in this society. And so I look at each of you as researchers, but also as spirits, as people who have an obligation to not work within those systems of racism and discrimination and bias that are systemic in this country, that are now being rebuilt and reinforced at the federal level in front of our very eyes, and say, what are you going to do about changing systems? You have an obligation, a duty, to change the systems of funding in academia. When we look, and that's what it is, it's an administrative inequity. You cannot come ask community-based organizations to do work and to do, to do this work with you and to really develop research without coming to us with dignity and respect, giving us that dignity and respect. Yes, we're not professionally trained. Yes, we're not degreed, but we are very smart, and we are people who are driven and committed to changing and improving our communities and uplifting them. And we want you involved with us in that work, but also to bring the resources to do that. Because health equity is one part of it. But equity in our world, it's money plus power equals equity. It really does. It really does. We need the resources because what we do in our community-based organizations is that we build wealth within our community. We hire our community. We bring them in and train them. I have people who aren't degreed, who are directors of our health program, directors of our victim services programs. These are high school diplomaed people who have become content and subject area experts. You have to have that, you have to bring that dignity and respect. We've earned it. And you've got to come in with that. And we will work with you. But we also want to talk about that income inequity, that funding inequity. When we have academia and universities that have 49 and 52% indirect rates, and when I say indirect rate, those are the dollars you get off the top of any grant, right? The dollars you get off of any funding, you're putting out. That's your money. It's unrestricted. You don't have to report on it. It is your dollars. And then what's left over, the academic universities take another 40%. And then they're telling the community, here's your 10%. Now, do all this work for us. We need you organizing. We need you using your facility. We want you to help moderate and host town halls, forums, study groups. And then at the end, we get a little, thank you, Servicios de la Raza. After 5 years of longitudinal study, after 5 years of creating a significant data, a baseline data, national baseline data in a particular area. It's thank you for helping us. That's not going to work. We've got to change that. So, and how do I move this forward? Because I'm sorry, I start getting, I'm very passionate. Some people call me angry. It's called passion. Oh, very good. So again, let's go to the agenda. That was my intro. And Dr. Bull and Dr. Sheena Bull, very excited to have her working with Servicios de la Raza. She's on my board. Shh. Anyway, but no. And also we have some other people on our board that works here at the university. And they are seeing this. Just an example about funding inequity. A 2011 report came out by Hispanics in Philanthropy that says out of every dollar spent on Latino or on their giving, and we're talking the national foundations, right? The Kellogg's, the Mellons, the Fords, Annie Casey. Every dollar of funding, 1 penny goes to Latino-based organizations. 80% of that penny went to organizations, Latino-based organizations in California. The other 20% of that penny funded everything else, not just in North America, but Mexico, Central America, and South America. And we, again, you've seen all the people who've come before me have talked about we're exploding as a population, and yet that funding has stayed stagnant or has just increased. This was 2011 on that penny, and now it's about 1.5 cents. So they've increased it, right? Not too dramatically. Here in Colorado, our top 13 foundations in 3 giving years from 2013 to 2015, over $253 million given in general operating support, which is unrestricted, right? The holy grail of funding for nonprofits. And capacity building, which helps build our capacity to to provide those services, to report on those services, to steward our dollars. Only 1.5% went to Latino-based organizations in Colorado. And we're 30% of this state. Some people say 23. We're always underreported, always, because we're not opening our doors a lot, right? We're a high-touch, multiple-touch population. You don't engage us at one time, at 2 times, at 3 times. We might engage at the 4th time, sometimes at the 3rd time. Politicians don't understand that either. So, you know, the status quo, there is an urge for assiduous application, effective dissemination, and to produce evidence-based guidelines and best practices. There's an urge to increase the public's health and science literacy so that people will consume, quote, people will consume research more intelligently and school-age children can integrate knowledge into their educational experience. Status quo. The community perspective. This is our perspective of what happens. This is, you notice that we're giving much more than we're receiving. And that's always been, and that's been my experience too over the last 10 years. We've produced we've worked with a couple longitudinal research projects. One was with the University of Denver around victims of domestic violence and pets. And that's one that I talked about, that we produced a national baseline for Latinos that wasn't in existence before. Yet the field of public health yields ample evidence that disseminating the results of studies and telling people how they should incorporate this information into their lives produce minimal behavior change. And I think Dr. Bull and some of the previous presenters alluded to that. The research is not working for us in our communities. So how does that change? Who decides what community needs? How do you know what people need? Ask us. Ask the people. And you all are the people too. You come from communities too. Communities have a spirit. They're emotional. They're living and breathing entities. They evolve by the second. At Servicios de la Raza, why we do good work and why we're so effective in impacting community is we understand that. We don't say we're competent in culture. Competent, you can't be competent because culture is breathing, living, evolving. But we can be responsive to that culture. And we're not talking just ethnic and linguistic cultures. We're talking cultures of the streets, culture of poverty, culture of the prisons, culture of offenders, of veterans, of parents, single parents, culture of gangs. There are all kinds of cultures. And you can be responsive. And that first item of responsibility, that first duty to responsibility is dignity and respect. It's treating a homeless person as well as a U.S. Senator coming through our doors, if not better. So we are not a data repository. We're not a test tube. We're not a group of people eager to receive what other things we need. And we're not uniform. We don't walk in lockstep. And we're a group of people with diverse characteristics linked by social ties, share common perspectives, engage in joint action, geographic locations, or settings. But I also talk about our psychological, emotional, and spiritual sides. We cannot just address physical needs. We cannot address social needs. We have to also address the whole person. And that's what we do at Servicios. And I hear the mental health thing. We do it so well because we work through an anti-oppression lens of practice, what other mental health centers and substance abuse centers don't know or refuse to do. We take a potpourri of practice and philosophy and concepts from people like W.B. Du Bois, people like Frantz Fanon, people like Paulo Freire. And we mix those up and we look at art and we work from them around an environmental observation and work, environmental and societal. This is public health. We are living in a system that was built by racism, discrimination, and bias. We have been siloed in these incredible silos of hatred, silos of indifference, of marginalization for over 500 years. As Latino people, as Chicano, Mexican, Latino, indigenous people. We're descendants from the first peoples of this hemisphere. We didn't cross any border. The border crossed us. Even though I'm a native English speaker, I have been here 21 generations on my dad's mother's side, 14 and 16. You know, Tiwa Pueblo, Apache, Navajo, Tarahumara from Mexico. We've been here, you know, and so this, I don't call us immigrants. We migrate. We just walk them back to our historic homeland. So once we understand that, we know our history, and we know how we treat our people. And so who decides what we need? You know, community, I mean, we share dreams, ideals. We share needs. You know, we need to be a partner, but we need to solve our own problems. We need to be approached to respect our self-determination, that we can do the work with you, that we just can't clean up after you or have to clean up after you. We can actually sit behind the desk with you and do that work with you and learn it with you. Just train us, but also share the resources equitably. You know, so consider the differences and similarities among the participating communities. Obviously, no cookbook approach. Communities, don't forget. We don't forget. Like Dr. Bull said, don't leave us and then come back 5 years later and say, guess what? Stay with us. Help us. Help us build capacity. Come and volunteer and do some work when, I know you're busy. I know professional and students and professionals and masters and PhDs, extremely busy. But you got to get out of these towers and come into the community and be with us. Just come and help volunteer at Thanksgiving turkey basket giveaway with 700 people, giving out 600 coats, enrolling 100 into health insurance, 70, giving and ensuring 70 people have safety seats for their children 0 to 8, right? And learning and talking to people. It's fun. Work on if you're introvert, helps you to come out of that shell. If you're extrovert, you'll love it. So we can mend fences. We can respect each other. Again, we're 46 years old. We come from, we work with, and we work for the people, and that equals trust. We are a trusted hands agency. 9 programs, we're at 10 now. We just stepped off our statewide. And very excited about that, Dr. Bull. Expanding statewide and serving other populations need proven leadership in the community. Last night I was just presenting to 40 families in East Denver at the Hope Center on family leadership training. And young people there too, young leaders. I'm talking 10-year-olds and 12-year-olds who got up and spoke and presented. Amazing. And empowering these families to start developing their own voice. Empowering them to become civically engaged and determine their own destiny. So education is part of our mission. We look forward we look at collaborating with researchers in education and academia. Again, another one from Dr. Bull, a little bigger for you. Equality and equity. Equality is Servicios de la Raza getting a regional grant to be a regional healthcare connector, and then getting it taken away, getting it promised, right? So, because they gave like 24 of these grants around the state, and they came to us and told us, and this is an example, we really feel that because of the Latino community, the importance of serving the Latino community is so high, and that you do such good work, we're going to give you a grant around a demographic grant, not a geographic grant. Then they called, in 2 weeks, we got to put it in, and we thought we had it. They called and said, well, you were denied because they thought it was dangerous to give this kind of money to the Latino community. What? We well, we didn't want to silo it. And I said, well, let's see, we've been siloed for over 500 years in these systems that have created the disparities under which we suffer. We don't create this. We're not in those positions, elected and appointed positions of power. We didn't create these systems. And I hate to keep talking about our resilience because it just means we keep taking a good beating and are able to get back up. We got to start deconstructing these systems. So again, I go to you and say, this is part of your responsibility in academia, is to help deconstruct the system that continues to exclude, that continues to marginalize, to discriminate, to create a system of inequity and disparities for our communities and communities of color and communities of poverty. And so, yeah, this is, that's Servicios in the little red car. Though we be little, we be fierce. Anyway, the community perspective. It should be community-based participatory research and not research with participation of the community. And we need to move towards administrative equity in that funding. So thank you very much.